Hello, lovely people. I'm Dolly. Welcome to Lolly Queen Zone. Today we are having a discussion on peptic ulcer. And if you're new to the channel, please subscribe. If you're a returning viewer, I love you so very much. What is peptic ulcer? Peptic ulcer is abdominal discomfort or distress 45 to 60 minutes after meals or during the night, both relieved by eating, vomiting, or antacids. So, how do you know that you have peptic ulcer? The definition states clearly there is abdominal distress after eating. It could be even during eating or before eating, and sometimes it wakes you from your sleep. Then there is chronic but periodic pain. So sometimes you don't feel the pain, other time too you feel it. So it's chronic. The pain is somehow always there, but it comes at particular instances. And there is abdominal tenderness. That means if you press your abdomen at particular portions, there is pain there. And due to the anatomical regions, we will know if it's related to your stomach or your duodenum. Peptic ulcer is like the broad term for both gastric ulcer, that's stomach ulcer, and duodenal ulcer. Duodenal ulcer is the ulcer that affects the first part of the small intestine. Ulcer in itself means sore, so there is sore in your stomach, that's gastric ulcer. And then if there is sore in your the first portion of your small intestine, that's duodenal ulcer. Most of the time mainly attributed ulcer to high acid in the stomach, which is partly true, but in the pH of the gastric juice is between 1 and 3, so it can even burn the face. To prevent it burning your stomach, there is a mucus layer called mucin that lines your stomach to prevent it from corroding into the stomach and causing an ulcer. For people who have gastric ulcers, there is minimal um there is even reduced or normal pH of the gastric juice. But then most of the time for people with duodenal ulcer, they have increased acidity, so the pH is lower. Before all more research was done or conducted, building it to the high acid or the stomach. But right now we attribute it more to H. pylori and NSAIDs. NSAIDs are drugs like aspirin, Ibuprofen, Diclofenac. Those are known to cause gastric ulcers when taken for long time. And NSAIDs together with smoking, people who smoke a lot tend to have ulcers, especially bleeding ulcers. That means the ulcer has begun to bleed. You can have ulcer that's not bleeding, but then these people have increased um bleeding ulcer as compared to other groups that do not smoke. And then H. pylori. People who have H. pylori infection usually have a decreased acidity. That means the pH of the gastric juice is increased. It has become more basic. So the basic environment encourages H. pylori to come into the stomach and then go and cause ulcer. And then if there is an ulcer, it can also encourage H. pylori to come and supplement it. People who are known to be O blood group also have an increased risk of getting peptic ulcer because they have increased acidity. That means the pH of their gastric juice is quite low. So I just said that the increased acidity is usually linked to duodenal ulcer. So it wouldn't be surprising to find most old people with to have duodenal ulcer. So to the treatment of ulcer, the home treatment, I would say, first of all, you have to avoid your triggers. Avoid spicy foods. I don't know, like you have also you're eating a lot of pepper, you're eating a lot of spicy foods. You're just going to make it worse. You're going to make your symptoms worse. So you want to avoid your triggers. Then secondly, you want to for the home treatment, you can take raw cabbage juice, 1 liter in divided doses for the day. If you have a bleeding ulcer, sometimes it's visible, like you can see the blood in your stool. Other times too, it may not be visible and can be found on microscopy. Like when you go to the hospital and they are examining your stool, they may see blood in it. So if you have a bleeding ulcer, you can take aloe vera juice and it would help seize it. The clinical view, the you can be taking antacids, but you have to make sure that you don't abuse the antacid you are taking, because if you're taking way too much antacids or you are overdosing it, you are persistently taking it, you are going to end up lacking some vitamins because the antacid can prevent some vitamins from being absorbed. Stress has been known to cause ulcer. So you want to avoid stressful situations, or if you are in stress, you want to find your own coping mechanism that wouldn't make you so overstressed, because stress has been researched and has been proven to be a cause or worsening your ulcer. And also, if you are in the hospital setting, your doctor may prescribe proton inhibitors for you and so many other things. They can do surgeries and a lot of things that they can do to help you cure your ulcer. But first of all, you want to be sure it's ulcer, so you want to do a blood test for H. pylori, or you can do an endoscopy whereby they will pass a tube through your mouth to your stomach to examine it if there is an ulcer there. I hope you love this video. I love you so very much. But before we go, let me introduce you to this awesome shower gel I've come across. It's the best. You got to try it. They come in 4 varieties, 4 different fragrances, 4 different combinations, and I hope you love it because I love it. As you can see, I am glowing. There was a time that I could barely sit in front of the camera and reveal my face without makeup, but right now I've been doing it, and it's all thanks to this particular product that I've found and I'm using. So sorry. So I recommend each and everyone to grab this. It's amazing. Dignified shower gel. It has honey, it has vitamin E, and a lot more essential oils. You don't want to miss out on this. Love you so much. I'll see you another time.